Mr. Long?
Here.
Mr. Matheson?
Here.
Mr. Payne?
Here.
Ms. Reese?
Here.
Mr. Carlton?
Here. Okay, if we could, let's stand for a moment of silence, and then we'll have our pledge, and I'd ask Herbie Adams, if he would, to lead us in the pledge. Mr. Adams?
To the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right, so we are at a called meeting of the board, and the first and probably the main reason for us to be here is item number 1, which is a discussion and approval regarding reassessment of in-person learning for students of the Johnson County school system during the COVID-19 pandemic. And I'm going to start this by opening with Dr. Simcox, and then I've also asked our Director of Health, Wendy, who's also a nurse practitioner, to come up front because she's an integral part of our discussion. So, Dr. Simcox?
Yes, I do want to start off by saying, our teachers, our assistants, our custodians, our cafeteria workers, bus drivers, every employee in the school system is working so hard right now. And, we're just thankful for everything they're doing. Our nurses, Wendy is, I will have to say, is the hardest working person in the school system at this time. She's definitely working 7 days a week, 24 hours a day to keep up with all these contacts and positive cases and quarantine. So I do want to, just say we appreciate everything all of our employees are doing, because they are working extra hard to ensure that our students are learning and being safe and healthy at the same time. One of the things that I've been doing for the board is I send them a daily update of cases. And I don't know if, for those that are watching online, you can probably see that on the screen. The board members have that in front of them. But it has our daily active cases, and it's broken down by students and employees. And as you can see, now these numbers were at about 3:30 today, and Wendy's updated a little bit since then, but what you're seeing was of around 3:30 today. We do have a dashboard located on our website that is updated daily with information of active and quarantined students and employees at each school. So if you're looking at this today, we did not have any new cases, employees or students. Total active student cases right now in our system. And again, this was at about 3:30, so it may be a little bit different. So Wendy, if it is, if you'll just please let us know. We had 8 active student cases and 234 quarantined students. And what I want to mention about quarantined students is, some of those are contact traced students, so they would be out for 14 days. Again, I know there's been a lot of concern and frustration over that 14 days, and I know Wendy will discuss that a little bit. But, we're having to follow the guidelines set forth by the Tennessee Department of Health and the CDC. That's their guidelines that we're having to follow if they are contact traced to a positive case. Some of these may just be showing signs and symptoms, allergies, flu-like symptoms, and they may not be out 14 days.
Right.
They may get to come back once their symptoms. It's just those students that are sitting beside of someone who tested positive or close contact. As you can see, our total active employee cases right now, we have 9. Quarantine employees that are household contacts, so they have to be out for 24 days unless they test positive. We have 3 in our system. And then quarantine employees, but because we are critical infrastructure, they do get to work. We have 30 with that. At the bottom, and I know Ms. Miller will speak on this a little bit in just a while, but it is also the breakdown of the grade level and school of our virtual learners. We have 19% of our student population that chose to go full virtual, and we are having some discussions around that, but we will get to that a little bit later. But I just wanted to share this information with you right now.
Okay. So before we get to too many questions and get us off track, Wendy, if you could, let's talk a little bit more and let the board ask you questions about the chart and what you're doing and why you're doing what you're doing. So if you can you explain to us a little bit of some of the issues that you've had, particularly with quarantine students? I think that's been an issue. how do we pick one student to be quarantined and not another?
Okay, I want to address that a little bit more too, but I can in a few minutes. We have had a lot of calls because of the 14-day quarantine. A lot of parents, I've went over and over, do not understand that that's something we can't change. If they, sit beside, front, back, and I have that on the algorithm, depending on, the circumstances in the classroom, or a teacher, we have to contact trace that whoever that student or teacher tells us they were around, and then they are out for 14 days. And that is regardless if they decide to go and test negative. So, they can go test negative, they can go test with no symptoms, but they're out 14 days.
And the reason for that?
Because that's on the...
No, but testing negative, you may not have, it may be tested too soon.
Maybe test too soon.
So they still have to spend the
Possibly.
14 days.
Right.
And as far as the quarantine, so address why some students then are quarantined, but others who are in close proximity may not be.
Well, if you were a case initially, within the 3 months, you do not have to re-quarantine
Because you've already
because
had,
you've already got immunity. When your 3 months is up, you're right back where, day one, and you can, but, so that's potentially why if someone was around another student, they didn't get quarantined because they possibly had immunity.
I think that's a misunderstanding some of the parents have and wondering why my child but not another child.
And you have to protect HIPAA, so they need to, they understand that I can't just say, whoever it is, but that could be a possibility. That's not the only circumstance, but that's the majority of why somebody else might not have went into quarantine because of the proximity of that person. Or, for example, also if it was a teacher, who was put in isolation, we're going by whoever desk or whatever was closest to them within the 6 foot 15-minute time frame. Unfortunately, depending on how the teacher did that in alphabetical order or whatever, that's where it falls. But, or if those kids are on the front row, because most of the front row is within 6 feet of the smart boards in most of the classrooms.
Anybody want to ask questions before Wendy moves on?
Are you good there?
Okay.
So another issue that we're having is, we talked about before that we would, if we didn't have parents come pick up their kid, that we would send SROs out and whatever we had to do. Well, we've had to initiate that several times because obviously numbers are not updated. Parents just flat out refuse that they're not leaving work to come get them. And, we can't do that. We've actually had to contact DCS a couple of times because it's just not acceptable. And we told them that, 2 weeks ago that's, if we came back to school, that's what we had to do. I know grandparents have had trouble with the work, but we've had some grandparents, because they're elderly and more immunocompromised, that they're raising their grandkids, but they refuse to come and get them because they don't want that back in their home because that student has already been exposed. Well, now grandma or grandpa don't want exposed. Well, we can't keep the kid at school forever and wait, and then, it's ridiculous that we have to call DCS for something like that. I don't want to call DCS at all, but you can't just leave this kid there for that reason. So that's been kind of a battle at a couple of our elementary schools. It's going to continue until we can actually space out 6 feet, 15 minutes. We're not being able to do that. At 100% capacity, we have not been able to do it. We are literally 2 to 3 feet away in the classrooms. I'm just being honest. I know that we needed to start back, but I don't think 100% has been a disaster, in my opinion, these last 10 days. Because, there's just no way to social distance, and we're going to continue with the 14-day quarantine until we can separate them 6 feet apart. If I can separate the kids in the classroom 6 feet apart and somebody winds up positive, I possibly don't have to quarantine anybody because we are at the acceptable distance for the 15 minutes.
But that means that you wouldn't have to quarantine them, but they could still be positive and still be passing coronavirus in the classroom.
Well, that student, they could be, but since you go by the 6 foot, 15 minute, and that's how you quarantine. Now, if
Right.
somebody else, in the room becomes symptomatic, obviously we're gonna, say go get testing, whatever, but the quarantine piece is what we're having the problem with, and we can't get around it. Dr. Simcox has asked, I've asked probably 15 times, I've got it in writing from an email from Dr. Thomas, from the Department of Health, that, regardless of that situation, you cannot get out of the 14 days. Now, also in that, we are sending some kids home because we were instructed due to seasonal allergies with those symptoms, and then you've got the chart in front of you that shows the high risk, low risk symptoms. We're going by this algorithm. Part of that is, I don't know if they have COVID or not. Most of our kids we've sent home have wound up testing negative. But because of this, we have to quarantine initially. It doesn't mean they're out 14 days. They can go get tested or be home for 24 hours and symptoms resolve, they can come back. We're also having, parents, they're sick, kids not showing symptoms, but they're wanting to withhold them out of school anyway because they think they might have it. Well, I don't like that because that's a day missed unnecessarily. I've been like, don't do that.
We told the parents if the child was sick, not just necessarily if they had the contact, correct?
Right,
To hold them out.
right. But only if they're sick, but we've got parents who are sick at home and holding their kid out regardless, even though they're not showing symptoms, which is, basically hurting attendance anyway, but we've instructed not to do that, but they feel more comfortable doing that so that they don't risk exposure to someone else.
But in your
Down the road.
discussion on quarantining and our decision whether or not to do 25, 50, or 100%, and what we talked about the last time was whether or not students are really going to be social distanced, and if you're talking about the safety end of it, not just the practical part of quarantining, the safety end of it is, are we passing coronavirus on to families, and are we having an epidemic in our schools? If we look at your numbers, you're doing a good job because you're protecting everybody, and you've got 234 people at this point who've been quarantined. But what you're saying is that some of those then are coming back before the 14 days because they test negative,
Or trying to,
okay?
but
you only have, and I mean, every case is a serious one, but out of our school system, there are only 8 active cases among students. No new ones today, and there's only 9 active employee cases. So seems like you're doing a good job of keeping everybody. The quarantine seems to be helping. I know it's frustrating, but it seems to be helping to keep our numbers down. Because there hasn't been any huge outbreak, has there?
there's not been a huge outbreak since September 16th when we came back that first day. We've been in school 10 days. We've actually quarantined and isolated in a combination of 78 staff. We've been able to operate in our critical infrastructure, very minimal. We've not been able to get subs, but we've been filling assistance, and that's dwindling down. But the part of the critical infrastructure, it's been positive and negative because we've been allowing them to come. They've had someone in their household that's pending testing, but it's not affected them. But then later on, some of them have come to work symptomatic, which has caused a quarantine.
How many of your staff or students were quarantined because of the outbreak at the prison among staff?
That's been a problem, a major problem.
The majority. Yeah.
Most of them.
And we're still feeling the effects from that, correct, Wendy?
Yeah, we are. And 413 students have been initially quarantined total since the first day.
So it didn't come from the school, it came because of an outside contact.
That was my question. How
Pretty
many
much.
of these positive cases came from within the school? Do we know?
No, most of them's been outside contact, but then we've had a couple, I don't know the exact number, I didn't break that down, but I would say maybe 4 or 5, but we've had a lot of contact tracing quarantines because of those household contacts, that kid coming to school or the teacher who was exposed but unsymptomatic. But then you have to go back to 48 hours from the time they come down with symptoms. So whoever they were around, within 48 hours of their symptom onset, you got to quarantine. And that's been a mess.
Out
Like
of this 234, we've got students.
Well, it's actually 266 at the end of the day, still on
266.
quarantine and isolation.
Okay. Now, how many of those students are on their, say, day 12 of quarantine?
I don't know, it's date, well, these numbers today, it may be about half, if that, I don't know exactly without looking at that, looking at my actual number dashboard, because it changes, some of them change daily because they end up positive in their house, or somebody else ends up positive in their house, and it extends it.
It extends it.
Or it could drop them down because they become positive themselves. So that's just all over the place. That's, we're keeping the dates down and trying to get that to the principals, but it's.
I know it's hard. I couldn't imagine trying to keep up with them. Same question for the employees. You got 30 employees.
I've got 38 out on either isolation or quarantine, but 17 are actually out in isolation because of a household contact or, isolation on themselves. But that's only helped because of critical infrastructure. But we have had we're still pending some tests for students and staff currently.
Looks to me like you've done a pretty good job of, well, everybody has, of keeping the actual cases down.
The nurses, I'll just say, live, that they have done a great job. I mean, I'm not taking all the credit. They have literally, we've been on the phone every single minute of the day. I go back to them in a circle just to get updated contacts, and they're just as overwhelmed at the school. So they've done a great job, and, I've had Shannon come and helping me look up stuff on Skyward to get the contacts to the Department of Health so they can start their contact tracing based on those names. But I mean, honestly, we are the only county that has the prison and that's hurt us. I mean, that has been the number one thing right now. But I feel like I don't see it getting any better until we stop this circle of the prison, because it's not over. I mean, I've still got other ones coming from household contacts from that. Luckily, some of them I'd already had on quarantine on household contact, or I'd be contact tracing multiple students there. And then we've not touched flu season with the exact same symptoms.
What's your numbers at the prison?
I don't have all the prison numbers. I actually had to call them.
49 staff, I think, something right around in there.
Yeah,
No, I'm talking about the convicts. How many convicts?
I don't keep up with them. I don't have any idea.
Are they rotating these inmates out? Bring them in that's carrying the disease in here, or what?
I don't know that.
No.
I do know they're quarantining people there, but, and I know they have some positive and they have some in the hospital now. I don't know how they're maintaining their folks through that, but
Are they isolating those inmates?
my
Yeah,
understanding is they are, but now
Yeah,
I don't want to
they
speak
are.
for the prison. That's my understanding, is they've got them separated by units.
And I don't know how they did their testing. I mean, I heard that, they did a portion of the prison, like maybe the annex, but they were doing some more testing later. I don't know about that,
A
but.
lot of the staff who were initially positive, that's been almost 2 weeks ago, so they're getting ready to roll back out of that. And out of all the people that tested positive, a lot of them never had symptoms, so that's a
Right.
good thing. But I go back to your numbers with the school based on what you're doing, and I know there's been an issue. People have contacted me about 100% versus 50% versus social distancing. But really, when you consider, our 2,000 something students,
2044.
and we have 234 quarantined, and then you gave us a number of students who are doing virtual. I mean, parents who are concerned still can do the virtual.
Yes.
They don't have to send their kids to school. We're giving them the choice. That's been the issue that's been brought to me, is, My point is, you've got a choice. We're not making you send your child to school. But also that 50%, and I think that's kind of what you were alluding to, so I'm gonna pick up on that. 50% versus 100%. 6 feet apart, if you're positive, are you necessarily not gonna, if I'm positive, are you not gonna get it if I touch things or cough or whatever? And I think that was our discussion the last meeting. For me, looking at your numbers, that is a high number as far as being quarantined, and you all are doing a fantastic job, and I think that goes back to our school staff and our bus staff as far as keeping things clean, because you only have 8 students positive, and you only have 9 employee cases, which I hate that you even have 17 people sick. But, okay, I'm sorry. I didn't mean to get into
No,
that.
that's fine.
I'm just asking before you get off your chart,
Yeah.
what else is,
I guess, what extra cleaning is going on now? Now, we're fogging it every day, is that right?
I don't know that they're fogging every day,
Fogging a portion every day.
a portion, yeah, not the entire building. We have the extra custodians that are, doing extra cleaning in between classes, during classes. They are working very hard. Bus drivers are disinfecting buses after the routes. And we just got all these measures in place to help keep, the classrooms, the hallways, cafeterias cleaned. They're cleaning in between every meals. I mean, I've been up there, I cleaned tables the other day. The principals, assistant principals, they're cleaning the tables between every meals just to help disinfect.
and we've stopped a lot of the cross action as far as people being kind of isolated in their classes or segregated as far as lunches. And
Yes.
Wendy, how are you doing? What describe to us what you have to go through every day, because the question, I think, one of the things in my discussion with Dr. Simcox, whether or not we need to provide some assistance to Wendy. I mean, because she's got a tremendous workload. What would help you?
Well, Shannon's been helping some, like I said, looking up Skyward, and I think Department of Health's gonna send a couple of their employees over, possibly to kind of help with some of this, because I think they're seeing the numbers related to the prison that we're going under. I mean, it starts at 6 o'clock in the morning, because people call wanting to, make sure they don't need to come or what they need to do throughout the day, and then it's contact tracing after till 10 o'clock at night. I mean, I've had the principals, help call, just so we can try to make sure those kids don't show up that day. I mean, I hate to call parents so late, but, you want to stop them before they even come or get on the bus or whatever. I mean, I don't know the solution to that. I mean, it's just,
Do we
I
need
might
to
need
provide
some
you some
help.
help?
I may need it. It's been
You're going from 6 in the
really
morning
bad.
to 10 at night, 7 days a week. You
It
probably
is.
do.
She is working very
It's-
hard.
It's been nonstop.
Well, you're doing a fantastic job, Tracy. That's obvious.
But
So can we agree that Dr.
Yours.
Simcox needs to do?
I thought we already agreed to that last meeting.
Oh, well, we
We
got some
agreed to the
extra.
Well, we did.
Nurses, I
At
don't
the
know, we
school.
give her anything.
I was talking to
Yeah.
give Wendy someone to help her.
Oh,
At her office.
oh, okay.
And we have given assistance to your nurses at the schools.
I mean, you got enough?
we've had difficulty finding licensed people, which we knew we would.
Yeah.
But besides that, it's a different person at some of the schools every day, which has made it a little bit difficult because you can't keep somebody at that same school to know what's going on daily. We've had to rotate. But overall, I think it's made a little bit of a difference of having someone else there. Because we've got to do our regular job duties besides COVID. We've got to, give meds and see the sick kids and just anything else we have to do. I don't know. My biggest thing, I don't know the answer, but the biggest thing is the separation deal. That's the problem. But I don't know how to get around it if you don't pull some of the kids out and try to space them out. I don't know.
Another quick question, this is probably to you, Dr. Simcox. One of our commissioners just texted me, and they was wondering why we start at 7:45, not letting children in at 7:45 instead of 7:30. Can you address that, please?
Yes, because they can't go to the cafeteria or the gyms to hang out. They have to go directly to the classrooms, which means the teachers have to be on duty at 7:45, and they work till 3:30. you know, we did not want to ask our teachers to be on duty at 7:30 to 3:30 because there has to be someone in that classroom. So therefore, that's why we are not opening the doors till 7:45. Because normally they do open at 7:30, but they go to the cafeteria or the gyms. You have bus duty. You remember that well,
Oh, yeah.
Mr. Payne. But, you know, this year we can't do that because we are trying to limit the exposure and the contact. So that is why.
I guess it'd be easier to trace too, if you know where they are.
Yeah, because they walk in, they go straight to their classroom and they sit in their assigned seat.
Well, that was my question as far as keeping people separate from just, conglomeration in the gym or.
Yes.
I mean, guys, I know the buses are running, but I've heard folks say there ain't you got a whole lot of kids. Parents taking their kids to school, keep them from riding the bus.
I actually had Dr. Long find that answer out, and
Our bus riders are down about 250 right now from where they were last year. Now, part of that's gonna be students that have opted virtual. But I do think,
Is there more traffic on the hill than normal?
yes, bus-wise,
Well,
yeah,
bus-wise,
Mr. Garver had a good idea, and he worked it out. So every bus in the county goes to the hill. We have no students swapping buses at the elementary schools, so we're avoiding
Okay.
cross-contamination there.
so that's part
Traffic
of,
on the hill, as far as morning traffic in general, has normalized. You know, it was rough the first couple of days, but that's every first couple of days. It's a mess.
okay.
But it has sort of settled into a routine. I know the buses, they were almost 4 o'clock the first day. They were almost 4 o'clock getting from the high school to Doe, for example, because I talked to Mr. Hageman about this. Now that they've settled in, they get Doe about 3:35.
Okay.
So everything has sort of just smoothed itself out. But our bus rider population is down, and it's difficult to tell how much of that is virtual and how much of that is, I'm not gonna put my child on the bus because of COVID if I can help it.
Right.
Plus you have
Both of
300,
those things are in play.
you have 382 virtual, and then you have 234 that are being quarantined. So you have almost 600 students that aren't going to school right now.
Correct, right.
Okay.
Now, on the buses, are they able to distance 6 feet apart on the bus at all?
No. And it, I think it's worth saying, the 6 feet is a CDC guideline as to who has to get contact trace, but in any of our reopening plans, we never stated 6 feet anywhere. And I only say that to say we're not failing to do something that we said we were gonna do. We knew that we couldn't do that on the bus,
We talked about that last.
and so we didn't put that in there.
Ms. Miller, I've got a question for you. How many students do you have that are not doing any schoolwork right now that you've had to follow up with?
We actually addressed that today, and that is actually, Mrs. Lang is actually working on that number right now. We have reached out to several students. We have sent SROs out. Before I was put in quarantine, I went out and did home visits, knocked on doors. You're not doing anything, you've got to be doing something. So, but as I said, we did meet today here at central office, and we are actually working on those numbers as we speak. And
So what's the plan for students who aren't doing anything?
I actually reached out to Chris McCarty to see what kind of, who is our attorney, our school board attorney, who, I know this is an issue probably everywhere with kids that are virtual. What can we do for those kids that are doing virtual, that are doing nothing? They're already going to be behind, sadly, but, we want to make sure that they're getting an education. And he actually has drafted a letter that once we have this list, I'm going to send out to every student who is failing, any subject. If they're on the borderline of, let's say they have a 69 and it's just one subject, then the principal's reaching out to them to help them. But in her first, she had done one school, and we already looked at some kids, and we got 4s and 9s. And so those kids that just are not attempting anything, sending them a letter and stating, if you don't, this is educational neglect, is how Mr. McCarty has addressed it, and we can make you come back to in-person if you're not doing what you're supposed to be doing virtually. So that's our next step, because we want our kids to be successful, and we want them to have a choice, but they also have to learn. So that is our next step with that, is what we're going to do for those kids that just are not doing anything.
What level are most of these kids in that's not doing anything?
It's spread across. The school we got today was an elementary school, but when we've checked numbers before, I mean, it's spread evenly from a kindergarten kid to seniors. So it's across, which is sad.
You know, we have areas where there's no internet possible. Are any of these students in those areas?
Now that I do not know at this time. Miss Miller might, because she's done the home visits with some of them.
Those students that are not receiving internet, you know, we were instructed by the board, ever how many meetings ago we had, to give them packets, and we are giving those families packets. So I spoke with one last week. They are sending them packets, they're returning the packets, and we're just going back and forth. So we are serving those children, and they are being served with packets.
And those aren't some of the students that we're talking about here that falling behind and
No.
not doing their
No,
work.
sir.
Okay.
Yeah, that was my question. Thank you.
And the younger children, it's not really I mean, I can see a high school kid, maybe a junior high school kid, but when you're in elementary school, especially your lower grades, if we're talking about those kids, that's not the kid's fault.
No, it's not.
And that's what we're running up against. Unfortunately, having to go out and speak frankly with some parents and get them on the ball.
And if children don't do the work and fail, they'll end up being retained.
They will be retained, you know, and that is not a process that we normally like to do, but, you know, that is something we will be doing this year because they will be so far behind. You know, we don't want to make them even farther behind, so we will be retaining if they are not doing anything.
What kind of, I don't know how to phrase the question. Kids they didn't go from March for the rest of the year last year, and then they come in and they're in virtual for 2 weeks, which I think pretty much everybody that I ended up talking to said kids were not learning on virtual. My son goes to ETSU, they're all virtual, and he's having a tough time because, you know, calculus, he's virtual, and he's saying, I can't, you know, I don't have any instruction, nobody's explaining this. I can't imagine all our kids all the way up. So, you know, my concern is if we go back to any form of virtual, number one is, are they learning? Ms. Wills, elementary level.
I have, just to be exact, there's 41 students that are virtual that are failing at least one subject.
41 that are virtual that are failing a
one
subject.
subject. But out of those, thankfully, it's not a lot of the K-3. There's only 6 in K-3 that are failing at least one subject.
What about your students who are in school getting some instruction, whether it be by a teacher or a teacher's assistant or a substitute? Do you feel like that is benefiting?
Oh, I definitely feel it's benefiting if they're in front of a classroom teacher.
Are they starting to learn?
Yeah.
Dr. Long, how about high school level, in the junior high?
I don't have the numbers in front of me. I wish I would have brought.
Well, just your opinion on, I mean, we're talking about learning, virtual versus.
Well, I can, as the supervisor, but then also as a father of a junior, there's a stark contrast between the two, with in-person being far superior as far as from a learning standpoint. It's, you know, just having the teacher there to explain and to, you know, to make eye contact, to ask questions, to answer questions, it's quite different.
Mr. Adams, how about CTE?
All of our skills classes are thriving. We had to go back and look at schedules for those that are virtual and what could be done and what couldn't be done.
Are you meeting some needs of the virtual student?
We're offering many of our classes online, but then again, there's a lot of things you can't teach online.
Don't want to forget Head Start.
We're doing wonderful.
Are your numbers consistent with what you've had in the past, higher, lower?
Our numbers are fine, but we have a lot that are doing packets and Google Meet. They haven't came back to school yet, but we do still have about half that's going to school.
I heard the 50-50 thing thrown out there a minute ago. And I hate to go around and ask again, but can students learn as well 50-50 as they do 100%? So the answer is no. So,
Mrs. Wells, the kids from age 4 back, have they settled down pretty good in school? I mean, since we've gone back 100%?
Well, that would actually be a question for Miss Blank, because she does the Head Start pre-K.
Yeah, our kids are doing great. I mean, they all wear their masks. The teachers have worked very well with them before school started and did videos daily with them to talk about social distancing and wearing masks and washing their hands when they did other lessons, so they're doing really good.
What about devices? Have we heard anything on devices?
Actually, Rob, and I know Rob can't really talk, Angie's pointing.
We just got an update.
Oh, okay. So she said we just got an update.
I don't know if Rob's even had time to look at it, but according to the email that he sent just a few minutes ago, it was 5:06, and he is hopeful that the first orders would be here in about a month, but the other orders, it says, would likely be December, possibly January.
And our first orders were those placed in March, April, with special ed, yeah.
So we don't have devices to give out if we did something different.
and we're not gonna get them this year.
No, I really don't.
So we can't.
I want to be
count on
optimistic, but I don't think we will.
So let me ask another question, and we may have already addressed this somewhat, but how are you doing, and Ms. Wells will ask you first, how are you doing with teachers being out? How many, do you know the number of your teachers being out, and how are you compensating for those teachers who are out?
I don't have the exact number, but we are, I mean, there has been several teachers out in each building. We are having a difficult time finding substitutes, but we are gonna do another substitute training, this coming week. But we are just pulling assistants. In fact, on Monday, we had to pull 2 assistants because a classroom at Rome Creek had been quarantined. We were able to pull some assistants to go to Doe to cover those positions that were unfilled, and that did help. Today was much better. It's just a day-to-day issue, and we're just covering as best we can, but so far we've been able to do that.
How about the high school?
The middle and high school it's the same. We have not had to pull any assistance. I think yesterday, unlike Angie, I'm not sure about Miss Wills, I'm not sure about the numbers exactly. Yesterday we had 6 at the middle school, and we had 1 sub. But by using the assistance that we do have available to us and being flexible that way, we have managed to cover all the gaps so far. And at the high school, it's been the same. Everyone's been willing to step up and help. We had some situations with some teachers out, and we've, it's not like going from Rome Creek to Doe, but we have sent, CTE substitutes elsewhere from their assigned area, and we've managed to keep everything covered.
And with the number of students that you have, let's say the high school, 28% are doing virtual, so we're not at 100% capacity.
No, so we run around 600, and so we've got 174, 173 on virtual right now, so, we're below 75% attendance as is.
Well, I think there's one group we forgot to mention, our special education department.
Yeah, Miss Norton couldn't be here this evening. Yeah.
How is that from your communication?
From our communication, I mean, it's going as well as can be expected. She is allowing us to pull special ed assistants to cover some classes because our subs are low. But they're still learning, and they're doing small groups. So I feel like they're being productive and doing the best they can as well.
We're not having to pull any of our one-on-ones, are we?
I don't think she has pulled any one-on-ones, but legally we can't really do that.
I didn't think
It's
so.
been more of just the regular special ed assistants.
Okay.
Yeah, if that student
But a lot of
has
the,
it.
and some of the one-on-ones, they may be on the virtual list anyway. So they may not, that student may not be there, so we're able to utilize them in that way.
Are all the schools, I know Mountain City Elementary School, I know that you can't social distance there, but are all the schools in the same situation?
I think it depends on the specific classroom, to be honest. You know, some classrooms may have 30 kids in them, some may have 25, some may have 10. So I think it just varies depending on the classroom. Is that correct, Wendy?
It does.
Based on
I've
what you've
actually
been-
had several of them go measure. I
Yeah.
mean, we've actually, you know, went and done that so we can make sure we're covering our bases, but some of them's pushing the second row of some of the elementaries possibly being quarantined. But none of the high school's probably the worst. High school, middle school's probably the worst. I've had teachers call me, they've got 30-some in the room, they can't, they're just packed in there, they can't do anything.
I think that's more of a secondary issue when it comes to the higher numbers.
Are we having any difficulty keeping masks on people?
No, actually, when we had our principals meeting today, I mean, I think the mask issue's not really been an issue. I know Mr. Henley had said that he's had a few, he's had to say, put your mask on, but they have. I don't know that anyone has sent home in regards to not wearing a mask. When we're out in the schools, they have their masks on, so.
Other questions? So now we have this as a discussion and approval regarding reassessment. What is the approval portion of this?
I guess it was just, do we continue, I guess, as is with 100%, or does the board want us to change how we're going?
I mean, do we even need a motion if we, unless somebody
Yes.
decides they want something to change? Is there a motion that we need?
I don't see it.
Mr. Long, do you, I mean, nobody else has a motion that they want to make on this. Is there anything that you're interested in changing as far as making the motion, or do we just move on, continue on as we are? I don't want to leave you out of that.
Well, that's quite
The
all right.
the approval portion is, does anybody want to make a motion that we change what we're currently doing? Today was to reassess, but is there any change that we need to make a motion on?
I guess I'd just like to ask Dr. Simcox, I know, I don't want to put you on the spot, but I guess that's what we pay you for. What would be your recommendation to us?
Well, you know,
What do you feel?
I'm a firm believer that, you know, kids get the best education when they're sitting in front of a teacher. I am a firm believer of that, but I do also support whatever decision the board makes, and, you know, whatever decision is made, we will make it work, and, you know, we'll definitely support it, but, you know, I am a true believer that they need to be in front of a teacher.
And then I guess I need to ask Wendy, can we do it safely, and can you do it with the staff you have?
I mean, we're trying, it's just a lot of arguing with the parents.
Oh, well, yeah.
I mean, they're gonna be quarantined over and over. I mean, there's just no way around it. Like I said, I've called the Department of Health multiple times. They will be quarantined over and over for however long. I mean, they have those symptoms on the sheet. They go home for however long, and then if they test negative, they can do their quarantine, and then 3 weeks down the road, that they may be in the same situation.
I did ask Commissioner Piercy, who's over the Tennessee Department of Health, yesterday, because we were on a call with her. Does she feel like the CDC or the Department of Health will change this 14-day? Because that is excessive, but she said she did not foresee them changing those guidelines at all.
Well, and it may also be safe, though. I mean, you know,
Yeah.
the fact that somebody has to be quarantined, they can still do virtual, correct? So are we still
Yes.
doing virtual with those who are quarantined?
Or they get a packet, right, Edna?
It really it depends on the student, and really they're staying with their teacher of record. So instead of going to a virtual teacher, that's really only for those kids that have signed up for full virtual. They're getting, but our teachers have done a great job. They're still using the platform for those kids that are sitting in their classroom. So they're still getting that work that they would get in the classroom. They're just not in front of the teacher.
But I mean, from my perspective, I don't see quarantine as bad. Quarantine is protecting our staff and our students and making sure this doesn't spread. Quarantine's not a bad thing, even if you have to have it done 2 or 3 times based on contacts. Again, from my perspective, I think you and your staff and the schools and the buses have done a fantastic job for us to not have any more than this, given the outbreak that we've had in the community at different churches or whatever, and in the prison. So,
Thank you.
but I mean, I don't see the quarantine number as being a bad number, especially then if you can do virtual. Because if we went to anything else, like a 50-50, they're going to do virtual anyway, I think. And I think one of the things I remember from our last discussion is the fact that how do we ask our teachers, particularly if a teacher ends up having to be quarantined at home, to do virtual and teach? And we can't go for, coronavirus is not going to leave anytime soon, so we can't just negate having school for a year or 2 for kids. I mean, they've got to have an education, so.
Well, what about, and I guess I just want to make sure we give our teachers and you guys what you need. And I know we have a handful of teachers across the county, so I can think of 5 off the top of my head, it might be all there is, that has 2 grades. How are they faring? Are we supporting them? Because they've got twice as much work.
Really, that's only impacted pretty much at Laurel.
I think there's 2 at
There's
Doe.
3
teachers that have 2 grades.
3 teachers that have 2 grades.
There's 3 at Laurel and there was 2 at Doe. Did we change that? The 6th grade at Doe, there was.
5th and 6th grade at Doe, they teach for example, Miss Fletcher, she teaches the math for 5th grade and then for 6th grade. They
Okay.
switch, so they're not in the same classroom.
Got you. Okay.
Laurel's the only one that has them in the same.
So there's those 3. I mean, I couldn't imagine being a teacher right now with all this on you, and then having to teach 2 grades. Are they getting the support they need? There's just 3 of them, but we don't want to kill them either.
No, I mean, I feel like they are.
The numbers at Laurel are smaller.
They're
than a
very
regular
small,
classroom.
and
You still got to teach the material. I don't
Yeah.
care if
and
you
they're
have
used
2
to
or
teaching that
20.
way. They are used to teaching that way because that's a normal year for them.
They
Yeah.
have,
Anyway.
At Laurel, they have about 74 students, and they have 12 right now that are virtual. And the teachers at Laurel, they don't have any responsibility for their virtual students right now, unless they have a student in their class that is quarantined, and they're treating that just as if they were absent normally. So.
How many did you say were in the class, the combined class?
In the school, there's about 74 students.
But how many in the combined class?
Miss Vincent has about 19 kids, I think, enrolled. Mr. Taylor has 15, I think, on his roster. And I think Miss Savory has 13. I could be off a couple. I don't have that exact numbers with me. But they're much more manageable than they have been in the past, other than Miss Vincent. Her class is very large.
And you're gonna figure out a way to help with Wendy so
Yes.
she's not.
I actually talked to her about that earlier today and told her to think of someone that could help her, and we would, if the board allowed, we would definitely do
I
that.
think
the
that
board's
if we
agreed with
create a
that.
job, doesn't that have to go before the board as a motion?
Well, I think we could probably just hire them as a supplementary, we're
As a
not
sub-
creating a
Go ahead and do it, approve it next time. We're gonna be meeting in 2 weeks.
And
we can
I'd
do it
like to
that
ask
way.
Ms. Miller a question.
Okay.
Ms. Miller, on these students that are getting the packets, now, how are they, if they're quarantined, how are they getting those packets to them?
I think most of those that are actually quarantined are doing the virtual in some way that I don't know of any that are on quarantine that are doing the package. There might be, and I'm not aware of it. but I think most of them are actually doing virtual.
Well, let me restate that. Those students that are receiving packets, how are they receiving them?
The parents are coming and getting everything,
Parents
or
are?
the guardians, whoever.
Okay. Does their teacher have those packets in that classroom for them, or does the principal have to issue that out to them?
I'm just thinking from when I was principal and you know, we had students were out, the teacher got the package ready and then put them in the office, and then the parents just came and picked them up in the office. When it was completed, you brought them back to the office took it to the teacher.
Okay, are these packets like for a week at a time or a day, or just a day at a time?
I think Angie might can address that a little.
At the elementary level, we actually have bins outside the school building so that parents can come by at a time that works best for them. And we have them broken down by grade level, so they'll just put the packet out. We're trying to do that weekly so that we're not running the parents to death to come to the schools.
Okay.
That they can pick the packet up whenever it's convenient, then they can bring the materials back when they pick up the next week's packet, but it's left outside at each school, at the elementary level.
Okay, if the student has the packet and they're going through the lesson and they have a question, now who do they contact for an answer?
If they're a virtual student, they contact the virtual teacher. If they are a student that's just in quarantine for a short time, then they contact their classroom teacher.
Okay.
There's not a motion, then we'll move on to number 2. So we leave the schools operating as they currently are, and, Dr. Simcox, did you say that this chart is on our website for folks to see?
No, this is a chart I send to the board daily. We do have a dashboard on ours, but it just breaks it. Lori actually takes care of that. It actually just breaks it down by active versus quarantine. New cases, active cases, quarantine, but it doesn't break it down to students and teachers. It just does an overall picture.
By schools.
By school.
Okay.
And that format's from the Department of Education?
No, each school district could devise how they wanted. The dashboard for the Department of Education just has you do daily active students, active staff. That's all I have to submit, and I submit that every Monday to the Department of Ed.
Okay.
All right, so item 2, approve the LEA reopening and programmatic supports grant for fiscal year 2021.
Yes, and the reason we have this on here is Angie did write this grant. We did receive it. The reason we have it on here now is because if we get your approval, Tina can start spending tomorrow. So Angie's just going to share a little bit about what this grant is in regards to.
Okay, so we were able to write a $40,000 grant through the state that was, these are funded through CARES Act funds, just as the ESSER grant. The items that we could put in the grant had to be COVID related, and so the majority of those things were technology based. We purchased some software at the high school level to support students for ACT preparation. We also purchased for the CTE Center some student licenses for an ICEV program. Mr. Adams could share a little bit more about that. And then also Electude, which was a program for CTE students to use that are learning virtually. We also put in a technology management system so that we can inventory all of these devices and technology items that we have in the district. We did not have, I guess, a formal tech program. Mr. Sutherland and Mr. Dickens, they have been keeping that in a spreadsheet. But when we go to do technology inventory, sometimes that's just a mess. So this program, we will actually be putting a sticker on the device, on each device. We'll have a scanner, so when it's time to do inventory, you just go through and scan all the items in your classroom, and then we'll be able to see what's there and what's not. We put in there funds for 25 licenses for Play-Doh, and that's a virtual learning platform at the high school. And that really took up about the whole $40,000, but you know, again, it was just for extra things that we need due to COVID, that will help us to meet the needs of our students.
And this will be a one-time grant that they'll let us have.
Okay, so do we have a motion on this item?
Yeah, I'll make a motion, we approve it.
Okay, we have a motion by Mr. Payne. Do we have a second?
Second.
Do we have a second by Mr. Long? Any more discussion, questions? If you will, call the roll, please.
Mr. Long?
Yes.
Mr. Matheson?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. And the last item is to approve Head Start Director Lori Plank to write the Head Start grant for the calendar year 2021.
And we just have to have this in our minutes that she can start writing the Head Start grant, which she is currently working on. So we just have to have an approval for that. So we wanted to go ahead and get that so she could start.
I need this, or do we have a motion?
Move we approve.
Do we have a motion by Mr. Long? Do we have a second?
I'll second.
Second by Mr. Payne. Any discussion? Anybody have a question from Lori? All right, if you will, call the roll, please.
Mr. Long?
Yes.
Mr. Matheson?
Yes.
Mr. Payne?
Yes.
Ms. Reese?
Yes.
Mr. Carlton?
Yes. Okay, is there any other item that we need to?
I would like to just make you all aware of something that happened today, and I do want to thank Chase for this and Rob and Norm. Hopefully, effective Thursday, correct, Chase, we will have our Johnson County School System app up and running. So Chase has worked hard on that through Apple. So once that gets up and running, I'll send y'all a little link. So if you have an iPhone, please add that to your phone. Very excited to finally have an app for Johnson County School System. So thank you, Chase and Rob and Norm, for that. Chase has done the bulk.
Not supported on Android?
I don't know, probably. Supported on Android as well?
Yes, every device.
Every device.
Okay.
So please download that. It'll keep you up to date with everything.
All right, and I think that, Chase, what were our numbers of total views of our meeting last time we met? Wasn't it something like 15,000?
Yes. Between, there's a local news station that shared it on their page. Between that and our streaming, it was somewhere around 15 to 16,000.
So I know we spent some extra money to make sure our system was good because of the virtual meetings, and I think this has been fantastic because there's a lot of people in the community who would not normally come to a meeting or normally know how we're discussing issues that now are getting it firsthand. So I think it's been very beneficial. I've had a lot of people make compliments on that, so I appreciate that. All right, well, this.
I got one more question
Yeah.
for Chase, if you don't mind.
Go ahead.
When will the ball games be online? I know we got some new equipment for that, is that right?
Yes, sir. So we got the equipment in last week, and we actually went live last Friday night with the football game. We didn't necessarily advertise that just yet because we wanted to test out the equipment, make sure everything worked well, and it worked extremely well. So from here on out, any sporting event in our gym or our football stadium will be live streamed through that equipment provided to us.
Oh,
they
the
can-
live stream on, is it a YouTube or?
It's actually a website, NHFS. That's who provided the equipment
Oh,
to
okay.
us.
So you're gonna let everybody know how to get that, and then they
Yes,
can
so
go to
once-
the football game and basketball.
Our next game, we'll share that on our website.
And that includes volleyball games?
It will. I do not believe they have any more this season.
They are done with home games. I think they're in tournaments this weekend, so.
So for the rest of the year, it will be mainly basketball, and I think we're going to have one more home football game.
We have two more next week and then the week after.
The football games will actually be patching WMCT, the radio station, in, so you'll be able to hear the radio station as you're watching the live stream.
Okay. That's cool.
Amazing. I know when I first got on the board, we were talking about smart boards.
Yeah.
Those are taking a pass.
That's obsolete.
Now we're talking about giving every kid a pad and watching things virtually, teaching virtually. All right, we'll have a motion.
I make a motion, we adjourn.
Okay, we have a motion to adjourn.